And there's a lot of type A's.
Yeah.
Yep. I've got all my colored pens.
I would have been like, did you take that test? Let me see.
For sure. Did she help you?
No.
What?
I think you just learn from other people, right?
Okay, because I would be like, oh my gosh, there's something in your ear. Like,
freak them out real good.
Gave me the weirdest look, like, what are you doing? And then I just fell, smacked my head on the bedside table, but it was fine. It's a wonderful job. I love it. I love the profession. But days are hard and days are long, and that is sometimes not always talked about.
hello and welcome to Good Job, New Mexico. I'm Stacy Johnston.
And I'm Karla Meléndez. And today we're talking to Jess Wood, who is a nurse practitioner with a background in family medicine. She works full-time at UNM Hospital and part-time at Bella Vita in Los Lunas.
Yeah, I still don't understand how she has the time.
Right.
It blows my
Full-time
mind.
job, part-time job, and it's, very important thing that she's saving lives, right? It's not like it's something that you can snooze at.
No, not at all. Just like the constant learning, being on top of everything, massive respect for her and everybody in the medical field. It's just incredible.
Yeah, absolutely. And actually, at the time that we're recording this, it is actually Nurses Week or National Nurses Week.
Yeah.
So shout out to all nurses, any healthcare practitioners. Yeah. Big respect. Thank you for all that you all do.
Thank you so much. And you know what else I'm jealous of? The dress code that they have.
True.
It's just
It is
like
very comfy.
the dream. Tennis shoes, scrubs. I wish.
It's also practical, right? Which is why they wear it.
I mean, I think it could be practical for the office. Like you've got pockets for your pens, your phones,
Yeah. I'm like, what else are you putting in your pocket, Stacey?
gum,
Chapstick?
chapstick. Really, it's just like multiple pens.
Yeah, all the pens.
Like today I brought two. Like, do I need two? I don't even need one.
We've got a red, we've
But
got a
I've
blue,
got
we've got a
them.
black, You got to have the
Sure.
variety.
You never
Highlighters.
know. That's what I need to add to the mix. Highlighters.
Highlighters. Yes, exactly. But yeah, it was wonderful chatting with Jess and getting to know how she balances all of those things. And she has great advice. So I'm excited for everyone to hear this one.
True, me too. And just the passion, you're going to hear it from her that she still has it from like day one, it seems like passion of what she's doing and continuing on.
Yeah,
So,
exactly.
it's awesome.
I think lifelong learner.
Definitely.
So without further ado, here's Jess Wood. Good morning. We're here today with Jess Wood. I'm really excited to talk to Jess and get to know your career path, your name, and what you do.
Yeah, so my name's Jess. I'm a nurse practitioner, and I work at UNMH in the inpatient side in hospital medicine.
But that's not your only job. You also have a part-time job, right?
Yes, I have a part-time gig at a small clinic in Los Lunas. It's called Bella Vita, and I work at the walk-in clinic, so just part-time on that one.
Nice. You're a busy lady. You're
Super busy.
It feels
yeah.
like it.
Yeah. Well, welcome, Jess.
Thank you for having me.
I want to know about your childhood, and was this something that you envisioned for yourself when you were younger, that you wanted to go into medicine and nursing?
I think when I was like a young kid, I was like, oh, I'll do interior design and it'll be this wonderful life that I was not talented at all. I actually took a sports medicine class in high school as a freshman, and the instructor had the upperclassmen like present different medical jobs and things. Then I learned about certified nurse anesthetist, and I was like, oh, that sounds really cool. So that kind of like opened the door into nursing.
And does medical run in the family? Are there other people that are nurses or doctors or anything like that?
So my sister's actually a nurse. She was in the program a semester ahead of me, and so that was also very helpful.
I would have been like, did you take that test? Let me see.
And did she help you?
No.
What?
No, I'm just kidding. She was very helpful, but we definitely have a competitive edge. So it was like, you got to get your grades on your own. And
Yeah.
I think that's just awesome to have somebody to like bounce things back and forth with, or like help you study or whatever.
And it's very nice to have somebody in your corner to like vent to a little bit, right?
Mhm.
It's very nice to be able to communicate on that level of like you have patience, you understand how stressful it can be sometimes. And so that's been great. And then I did the dual credit program through APS, which was awesome. I kind of led like straight into the nursing program at UNM. Graduated from that and worked in the intermediate care nursery at UNM, which is specialized in like the not super sick babes, but still a little bit like preemies, and did that for a while, and then bounced over to interventional radiology, which is a really cool niche of doing just procedures that are image guided. and then wanted to expand a little bit more. So went back to school to get my nurse practitioner.
And then, so how long were you nursing before you decided to go into nurse practitioner school?
4 or 5 years of nursing before going back to the program. And you have like bachelor's of nursing, but you still have to sit for your national boards. So that's something that I don't know that you realize at the time, right? So now you're studying further to get that registered nurse qualification.
Was nursing school more difficult than nurse practice? What do you think?
I think that nursing school was definitely more challenging because I didn't have any medical background. And then you walk in and I had nothing. Like I didn't know what to expect. First day in the hospital, I'd never been a patient.
And what was that like? First day in the hospital? Like,
It was deer in headlights.
Yeah.
You have your little cohort and a little group with you, but you're just trying to learn and stay out of the way at the same time. And then realizing, shoot, I have patients. These are like real live people that I got to take care of and get to, right? But that was a little bit of a scary thing at first.
What made you go into nurse practitioner school?
I was getting a little tired of some of the ways that things were going as far as like patient care. And I wanted to have a more prominent role in the way that we help people. I want to do more and have more autonomy. And that's the way to do it was through education. So
I was telling them before you came here, I had this question lined up. I'm very curious, especially when you were in nursing school, you're practicing putting IVs in and whatnot. Did you get it on the first poke?
I think I did.
Ooh.
Wow. Kudos.
That must have meant like that person was very well hydrated, right?
Is that the trick?
Certain things, yeah, for sure. Hydration status is helpful, but I've certainly missed plenty, unfortunately.
You would hate my husband because he was in the hospital for something and he had to get an IV. And this poor nurse, she had just come back from like a stent away. It was her first re-poking of an IV. And he was like, are you nervous? Don't be nervous, nervous. And it made her nervous. And she missed 3 times. And at the 3rd time, she was like, you know what? I need to go and get somebody else. I was like, way to go.
This is entirely too much. No, that's
Yeah.
funny.
So he deserved to get poked that many times. I was so angry at him. You got to treat your nurses nice.
Right. Yeah. I mean, you got to be sweet to the nurses. Yeah.
What makes a good patient?
I would say somebody who is able to communicate efficiently and effectively, right? The patients that I really struggle with is the ones that they come in and they're like, oh, I have pain. Okay, where's your pain? Everywhere. Well, what does it feel like? Pain. You know? And so it's difficult to kind of get to the bottom of what's going on without that specifics.
What's like your most memorable patient?
I was working at the walk-in clinic and this kid, I think he was maybe like 14, came in and he was like, my ear hurts. I think there might be something in it. And you're like, oh. And usually it's just like some earwax or an ear infection. And it's like first patient of the day. And I like go and put the otoscope in and there's a butt.
No, stop.
And I was like,
it moving?
It was moving.
Stop. I'm going to die.
It was like bugs in the air. And so I was like, I will be right back. A few things, right? Because you don't want to freak them out. But also,
do they train you on that? Like when you're going to be like shocked by something to be like, I'm freaking out inside, but like, I'm going to be really calm and it's okay. Like, do you go through training for that?
I think you just learn from other people. Right?
Okay, because I would be like, oh my gosh, there's something in your ear. Like,
freak them out real
good. Tonight I'm going to go buy earplugs. Like nothing's going to happen.
Nothing's going in there. Yeah.
Oh no.
So I'm curious, for someone who wants to go into this field, can you walk us through the process of like school? Like how long does undergrad take and then nursing school? And then how long is nurse practitioner school?
So if you want to go for like the baccalaureate, which is what they're pushing all nurses for, you would do your 2 years of prereqs and then apply for the program. And then if you get in, I think it's 2 years. They kind of adjusted what courses are going to be included in the program versus prereqs. So I think it's 5 semesters straight that you go year round once you're in the program.
And what is the program like? Like, you guys do clinicals and you rotate those clinicals, and what is that like?
Yeah, you have your didactic classes usually on certain days, and then a clinical day would be like a full day. So once you get into it, I think you can expect about 2 days a week in clinicals, and you get to go to different rotations. So you'll do like general med-surg nursing, but then you also get some time in pediatrics and the women's special care for like labor and delivery. And then eventually you get to your capstone where you do a lot of hours, not with a group, just with one mentor. And that can be night shift. It just depends on where you get placed. And it could be at any hospital, at least through the UNM program.
How do you keep up with the ever-changing medications and procedures and all? It's like a constant learning position that you're in. So how do you keep up to date with everything?
We have some really good resources at UNM. And because we're a teaching institution, and that's one of the biggest reasons that I wanted to work there, is that education is so important. So we have weekly best practice for, let's see, what is it called?
Professional development.
Yeah, exactly. And so this is every week. You have opportunities to relearn or learn more. And then there's also a lovely little thing called Up to Date. So if you needed to look up medication, procedure, diagnosis, any of those things, it's going to have the most up-to-date things. And you have to keep those up to keep your licenses. So we renew every 2 years. And I think it's like 50 hours of continuing education to keep both licenses.
During your training, did you ever observe anything or that was so scary that it made you queasy and or pass out?
Girl, yes, I passed out, but it was not over anything exciting, unfortunately. Yeah, it was one of my first clinical rotations, and there's like 6 of us in this room, and one of my peers was trying to start an IV for their first time, but I didn't feel good that day. I think, I don't know, maybe I locked my knees or something, but I pass out pretty frequently.
Oh, no.
I'm very sensitive.
Oh, no.
So yeah, I just remember like reaching for a peer, and he gave me the weirdest look, like, what are you doing? And then I just fell, smacked my head on the bedside table, but it was fine.
Gosh.
But it wasn't because of blood or like the needle didn't even poke the skin yet.
You know, I was in a wedding and the wedding planner, that was like her number one advice,
Yeah.
you know, standing up there with the bride, like, don't lock your knees.
She's probably seen it so many times.
Probably, but like the whole wedding, that's all I'm thinking about, like how I'm standing and am I locking my knees, you know? I did not pass out. It was a great wedding. They're still married. It's great.
So what advice would you give to somebody that's considering going into nursing?
I think if you have the opportunity to shadow, it might be a very good thing so that you can really see what you might be getting into.
I mean, it sounds like it helped you starting off with that class in high school that kind of piqued your interest.
I got to see SRMC when it was very first built. My sister and I got to go and see their OR and be a part of, I think it was a gallbladder removal. And so even though I wasn't paying attention to what nursing was doing at that time, but it was a little bit of insight into at least a hospital setting. So yeah, I think if you can get exposure to really see what the day in the life of a nurse might be, that would be important. It's a wonderful job. I love it. I love the profession. But days are hard and days are long. And that is sometimes not always talked about.
This is the PSA to treat your nurses really, really nice because they're here to help you.
And they'll give you crackers sooner.
Honestly, this is just for my husband. Like, PSA, treat your nurse really nice. Like, there's been other times where he tries to run out and it's like, they haven't discharged us yet. He's like, come on, let's get out of here. And I'm like, they haven't said go. Right? It's like, follow the guidance of your nurse. Don't like rummage through the cabinets for things. You know,
Right.
Have you caught people doing stuff like that?
Yes. And sometimes, they'll try to take extra stuff, especially on like the mother baby units. And I get it, right? Like diapers and bottles and formula. But somebody like somehow they stuffed so much and they needed 2 carts to push it out. And I was like, this is very obvious.
Right?
What's
in
happening?
that cart?
Just so we're clear.
Okay, so how do you prioritize your tasks for the day? Is there like a set plan when you go in? Like, here's our checklist, we're going to go through this? Or is it just kind of like day to day? You know what you need to do when you get in there?
Yeah, I think it's more of like a day to day. And it depends on what job you're doing. But like at UNM, you come in and you pre-triage. So you kind of figure out like what happened overnight, what's going on. So we do multidisciplinary rounds where the case manager and the social work. So that is like a set time. And then if you ever have family meetings, then those would also be like a scheduled time. But otherwise, you can round on your patients as you need to, meet with your attending, write your notes. But that's what I love about it. It's autonomous.
At least in my head, medical professionals are probably like the most organized
For
people
sure.
in the planet. Is that
sure.
true or is that a misconception?
I think generally speaking, there's a lot of
Okay.
type A's.
Yeah.
I've got all my colored pens.
And does that leak into your like everyday life? Like, is that you and yeah?
Yeah,
Okay.
calendars, love them.
I was going to say, what's that work-life balance like? And do you feel like you have a good balance?
For the most part, the way that the scheduling works is I either work 3 days in a row or 6 in a row. So the 6 in a row can be challenging to your health. And then relationships with other people, right? Like that's 12 hours and that you're gone. Usually there's a big break before or after that. And so just trying to take the time, go on vacations.
What's your most recent vacation?
We were planning a trip to go to Nashville. Never been. And we're going in August. I'm a little worried it might be too hot.
Oh, maybe humid. I don't know. Is it humid in Nashville? I mean, yeah.
I think
maybe,
so.
Right? Yeah.
I don't know. We live in New Mexico. I don't know.
I don't know.
Someone from Nashville, let us know.
Yeah.
We're going to ask you some rapid, not so rapid questions.
You can take your time. It's fine. If you could describe your current job using only emojis, which emojis would you use?
Smiley face, the gas face, the angry face, crying face, and then back to like what's the little one that goes like sideways?
Oh, yeah.
Sideways happy.
I like it.
Do you have any phobias?
I don't like bugs.
After that one patient,
Specifically, I don't like cockroaches to begin with, so that was not
so
fun.
that was your phobia prior to this patient?
Oh, yeah.
Oh, man. So this was
I
terrifying
would have
for
been
you.
crying.
It's not good.
What's your go-to lunch?
Oh, they have these really good veggie wraps, I guess. They have like avocado and cucumber and all that good stuff and like the little orange marmalade. Crunchy, and you maybe feel like you're eating well, even though there's a lot of sugar in that.
What's your most unusual or funny job that you had before entering into the medical field?
It's kind of ironic. I used to work for preventive pest control for someone who doesn't like bugs.
Is that how you learned you didn't like bugs?
Very much so. The techs would come and be like, look at these bugs. And they put them on your
No.
desk. And
Oh,
I'm like,
yeah,
please,
no,
please
no.
don't.
We are in New Mexico, and this is a New Mexico podcast. Red or green?
100% red.
Okay.
Yeah. Which is come a long way because before it was no chili. Like the answer was
That's
zero
neat.
spice.
How did you get there?
15 years later. In
Just
little,
like little
small
bits?
doses. Yeah.
Okay. So you got to start somewhere. That's really my challenge. I got to just start.
Well, thank you so much.
Thank you.
Jess,
Thank you guys for
being
having me.
here.
This was lovely. I'm excited to hear more of your podcast coming up.
Yay!
Bye. This has been a New Mexico Department of Workforce Solutions production.
Our producer is Mila Koleski.
This episode was engineered and mixed by John Sloan.
Theme music is One Fine Day, courtesy of podcast.co.
Follow the show on social media at GoodJobNM.
For program funding, visit dws.state.nm.us/funding.
Bye.
Goodbye.